So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere. So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere. So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere. So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere. So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere. So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere. So much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Can you hear me? Yeah.
We can hear you, Nazhan. Good afternoon here from Malaysia.
Alhamdulillah. Okay, all right. So all praise be to Allah subhanahu wa ta'ala for his gracious and merciful. First of all, I would like to thank Dr. Shaiful Ehsan and his team members for organizing such a very interesting CME MEDIIUM CME Series 2024. So this is the first CME that we organize as part of the MEDIIUM CME Series. So first of all, let me begin with the recitation of Kitab Al-Fatiha. So first of all, welcome to all of you again. So today we are going to have a very interesting discussion entitled Diabetes Management Modification in Ramadan. So we have with us today our beloved lecturers at IIUM, also alumni of IIUM, Assistant Professor Dr. Shaiful Ehsan bin Shalihin. So just to give a brief CV for Dr. Shaiful Ehsan. So Dr. Shaiful Ehsan is a pure IIUM alumni because he graduated MBBS and Master in Clinical Family Medicine, both from IIUM as well. So he graduated his MBBS in 2009 and Masters in 2018. So to recap or highlight some of his achievement based on his CV, he received book award in the 34th IIUM convocation for the master's program. He's also a columnist for Malaysian Medical Gazette, now a vice president for Family Medicine Specialist Association Malaysia, advisor of IIUM Medical Student Society, and of course, he's also an EXCO for IIUM Medical Doctors Alumni. So without further ado, I would like to invite Assistant Professor Dr. Muhammad Shaiful Ehsan to deliver his CME on Diabetes Management Modification in Ramadan. فليتفضل مشكورا.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Assalamu alaikum and a very good afternoon to all. Thank you very much, Moderator Dr. Nazhan, Afeef. And thank you very much to all for joining this program and this ME during Ramadan. Happy second Ramadan. I know that it's quite difficult to join the CME at 2 p.m., especially during Ramadan days. I'm sure everyone is busy with their clinical works and also their other works to do. And I'm really thankful for all for joining this program. So basically, as mentioned just now by our president of MEDIIUM, Dr. Nazhan, this is going to be a series of CME and other objective other than to introduce important topics pertaining to our specialty. We're also going to promote MEDIIUM to all. And inshallah, at the end of this session, on the end of the slide, I'm going to share a link for those alumni or for those ex-IIUM, either undergraduate or postgraduate, to join our society. There will be a link for you to join. And inshallah, I hope that MEDIIUM can contribute more to our alumni, inshallah, in future. So as mentioned just now by Dr. Nazhan, inshallah, it's going to be a concise discussion on this topic on diabetes management in Ramadan. And why I choose this topic is because until now, I think the prevalence of diabetes is increasing in trend, and 1/4 of our population are diabetic. And what important to know is that most of our diabetic patients, especially in Malaysia, are basically still fasting. So even though there are certain risk stratification being applied to them, but most of them have the desire, have the intention to fulfill and apply to our religion, Islam religion, in order to fast during Ramadan, which is good, but there are certain precautions need to be done. So these are the outlines of my presentation, inshallah, for today. I'm going to discuss a little bit on the fasting Ramadan benefits for our patients, including ourselves. What are the preparations that need to be taken by our patients before they go in or they're joining the fasting Ramadan? What are the certification that need to be done by ourselves as medical doctors, as well as by our medical health providers, in order to certify our diabetic patients either falls in the low risk, medium risk, or high risk in terms of complications that could arise during fasting Ramadan? What are the modifications that need to be done in monitoring of the glucose during fasting? and what are the signal, the signs and symptoms that need to be identified in order to advise our patient to break their fast during Ramadan, and what are the modification or continuous advice that we can give to our patients in terms of diet and physical activity prescription, and a little bit on Islamic input at the end of the presentation. So my guidelines or my information are basically from the collective guidelines from our CPG of diabetes management in Ramadan, and also information from International Diabetes Federation 2021, as well as some information from Jakin Fatwa and our Sharia compliance department pamphlets on fasting, and also guidelines for our patients from our SASMEC IIUM hospital. So what are the benefits? I'm sure that everyone aware about the benefits of fasting in Ramadan has been applied to all Muslims worldwide. So among the benefits that we can see and we can derive from evidence-based medicine is that it can decrease body weight. And this is much more implied or much more realistic to those patients who are obese and also overweight. And for those that consistently fasting and also practice Tarawih prayer, it has mentioned that from beyond 20 days, it can actually lead to further 500 gram or 1 kilogram body weight reduction at the end of the month. So this will be the average body weight reduction that can achieve for our diabetic patients. So with that weight reduction, inshallah, is going to improve the insulin resistance of our patient, and therefore it can increase in the glycemic control of our patients. Pertaining to dyslipidemia and also lipid control, it increased the HDL cholesterol level and also reduced the total cholesterol and also LDL level in our diabetic patients' blood profile. According to the landmark trial, according to the London Ramadan trial, it has shown that fasting can actually reduce systolic and diastolic blood pressure, ranging from 3 millimeter mercury to up to 7 millimeter mercury. So I would believe that this reduction is significant and can improve the profile for diabetic patients. It can improve the immunity in general for our diabetic patient, and therefore reduce possibility of having CVD risk during this fasting Ramadan. And also, because of the patient are fasting, they can appreciate the benefits of fasting. They can experience of getting hungry, and because of their contributing a lot of good deeds during fasting Ramadan, it somehow already increased the feelings of satisfaction and therefore reduce the possibility of symptoms of stress and anxiety among them, and therefore improve the quality of life of a diabetic patient. And everyone would agree with me that cessation of smoking is possible best to begin during fasting Ramadan because of the blessing itself, because of the patient discipline in fasting. It can improve the patient motivation to quit smoking at the first day of Ramadan. So we can imply this to our patient. They would like to choose the date for quitting smoking, it can choose during fasting Ramadan. So what are the preparations from the title of Modification of Diabetes Management? So we like to prepare our patient before entering into fasting Ramadan. So this preparation I mentioned just now is not going to be happen actually during the Ramadan month, but actually supposedly need to be done earlier before, meaning that about 6 to 8 weeks before the fasting month of Ramadan. And the approach or the preparation should be individualized, whereby all the healthcare providers and also the medical doctors need to identify, need to query, need to stratify the patient's profiles in terms of the patient glycemic control previously and currently. What will be the latest blood pressure control of this patient, the lipid profile, what will be the experience of a patient's fasting during previous years, and what would be the complication that the patient already arise, and what are the medications that the patient currently on. So from these parameters or data that we can collect from our patients, we can look at from our patient, we can stratify our patient either falls in the moderate risk, low risk, high risk, or very high risk. Why this is important? Because the higher the risk, the more risk for our patient to develop complications, either acute hypoglycemia or hyperglycemia during fasting Ramadan, or even severe dehydration. So from this risk stratification, in the green box for those at moderate to low risk, we can actually allow them, or which actually can give options to them to continue fasting. However, for those in the high risk or very high risk group, we might need to advise them to avoid or to not to fasting if it's possible for them. So we give an option. It should be a shared decision between us as the medical doctors and our patient in terms of either they would like to continue the fasting or not. So what are the changes that we need to modify or like to highlight in our preparation towards our patients who are going to fast in Ramadan. Definitely, we're going to review their medication regimes. So there are certain medication regimes that need to be modified during fasting Ramadan, especially those that can lead to hypoglycemia. So there'll be some reduction in terms of the dose, or often the dose, or we would like to withhold some medications during fasting Ramadan. What will be the meal planning for our patient? Definitely, we would like to advise our patient not to miss sahur during fasting Ramadan, and also what will be the appropriate physical activity for our patients, and what will be the appropriate time for our patients. I mentioned just now about blood glucose monitoring. There are some changes that need to be modified for our patients, and also we need to empower our patient to identify what will be the signs and symptoms, or what will be the readings for them to quit fasting, or to end or to break their fast if there is happen, and to recognize, importantly, to recognize acute complications that might occur during fasting Ramadan. So how we would like to re-stratify our patient? I mentioned just now, looking at the profile of our patients, so including the Ramadan profile, the fasting profile itself, the patient's profile, as well as the diabetic control profile. So I would say in Malaysia, there will be no much changes in terms of the duration of fasting. The longer the fasting hours, the more risk to our patients. But in our Malaysia setting, it will be about 13 to 14 hours generally in all states of Malaysia. And I would say that the weather is almost similar in all states in Malaysia. But we're looking at the factors of our patients, the age, the patient's occupation, the physical activity, either the patient is carrying pregnancy or not, what will be the meal pattern of our patients, what will be the other profiles of patient in terms of their preferences, in terms of meals, in terms of timing of sahur, that actually can affect the patient risk to develop complications during fasting, and about the diabetic control of our patients. So I would say that there is no single factor that will be dominant in stratifying the patient. It includes the collective factors of all these factors would need to be counted in order to provide conclusion for our patients, either they are actually high risk or low risk or medium risk in terms of complications during fasting Ramadan. So as has been highlighted by IDF in terms of the points or the parameters that we need to look for, is either the type of diabetes, the duration of the diabetes, is there any presence of recent hypoglycemia? So for those that have hypoglycemia unawareness because of the patient's age or because of the patient underlying comorbidities, is actually already fall in the high risk group. And also looking at other factors I would like to highlight here is that include the diabetic control, patient with complications, the renal status of our patients, and also pregnancy. So if we realize last time, we have been informed that if pregnancy considered as high risk group, but now the pregnancy needs to be divided into either the patient achieve targets for the diabetic control, or those patients with uncontrolled diabetes mellitus status. So those patients at pregnancy but within targets is considered the point of to be 3.5. So 3.5 considered as moderate risk, not high risk. So as mentioned previously in our previous slide, moderate risk can be allowed and can be advised to continue fasting, but some precautions need to be given. But for those that in high risk group, that means that they are pregnant and also does not achieve yet the targets of diabetic control, they are actually automatically at high risk, and therefore we may need to advise patient or give option to patient not to continue fasting. So this is important for us to highlight that not all diabetic pregnancy patients are high risk. We have certain criteria to say that it could be falls in the moderate risk. So another parameters that we can look into include the type of medication that the patient on. Definitely for those patients on insulin, the risk would be higher to develop complication, especially hypoglycemia. So how's about the monitoring or the awareness of the blood sugar monitoring during fasting? So for those that conduct the monitoring and can achieve the target accordingly, the risk will be lower compared to those that are not conducting blood glucose monitoring. What will be the physical activity of that patient, either having highly intense physical activity or not, and what will be the previous Ramadan experience that they have. So therefore, I would say that the experience also can be taken into for those that regularly practice fasting sunnah, which is during Monday and also Thursday fasting during previous month. So we can also ask about the experience during that time if patients do have some symptoms of hypoglycemia or any complications that they have. So we're looking at this, we will say that we're looking not only at one factor, we're looking at the collective factor of our patients, including the patient's profile, the patient's diabetic control, and so on. So now we're coming to the monitoring modification of our diabetic patient during fasting. So ideally, according to the guidelines, the advice is to monitor our diabetic patient 7 points, meaning that the first time is before sahur, and after that, after sahur or 2 hours after sahur, and during midday, and also during before sahur, which is pre-sunset meal, 2 hours after iftar, and any points of time our patient develop any symptoms of hypo or hyperglycemia, if they have this capability to monitor their sugar with glucometer at home. So I would say that these 7 points are really important to look at the patient's level of sugar during fasting, few hours just after taking meals, and also after quite prolonged time after fasting, example during midday and also afternoon, and to see the level just before breaking the fast. So it gives a variety of values during pre and postprandial, as usual, as I will monitor our patient during outside fasting time. Nevertheless, these implications of 7 points, it's actually, I would say that it's not practical to all patients, especially for those patients who are falls in the low risk of hypoglycemia, and also for those pregnancy mother, especially on diet control, who actually rely on follow-up at Klinik Kesihatan for the BSP monitoring. So there are 2 advice in terms of BSP modifications for our antenatal mother who are follow-up for their antenatal pregnancy in clinics. So they can actually do 4 points as usual, meaning that they do pre-sahur and also post-sahur value. And after that, pre-breaking fast value and also post-breaking fast value. So it's still 4 points of before meals and after meals. So there will be no pre-lunch or value before lunch, because the patient does not taking lunch during fasting. So it left with 4 points. Another suggestion is that to do 3 points for our antenatal mother during clinic follow-up who rely on glucometer monitoring at Klinik Kesihatan. They can do that early morning when they come to Klinik Kesihatan follow-up. So it means that it can be applicable to as similar value of post sahur value, will be about 2 hours after sahur. Another one, they can come during midday or early noon time, so it will be equivalent to midday or noon time of monitoring. Another one is towards the end of the clinic follow-up in the towards late afternoon. So it will be a value of few hours before taking meals for breakfast. So these 3 points also can give enough or simple values monitoring for our patients who are actually unable to comply with 4 or 7 points of monitoring, especially our antenatal mothers. So there will be some options for them if they would like to follow. So coming to the points of when we would like to advise our patients when they monitor their blood sugar level to end their fasting. So if they have a value of less than 3.3, for those that in the first hour of fasting have value of less than 3.9 millimole per liter, or at any time that our patient have blood sugar level of more than 16.7, so it's meaning that it could be acute hypoglycemia or acute hyperglycemia experience. So at any point of time, even without glucometer monitoring, if our patients experience symptoms of previous hypoglycemia that they have already achieved from the previous experience, we suggest them to actually quit fast or to end fasting, even without a value of glucometer during that point of time, because of they don't have the luxury of glucometer at home or don't have the access to the monitoring. They can already break their fast during that point of time in order to start taking fluids and also taking food to avoid other complications and directly get the medical attention from nearby clinics. And if patients have symptoms of severe dehydration, also we like to advise them to end their fasting. So what are the diet modifications for our diabetic patients for fasting Ramadan? So basically, there is not much different in terms of the balanced diet that we advise our patients, and the diet should include sahur. So our diabetic patients, when they are fasting, even to general patients when they are fasting, we advise them not to miss sahur if possible, because of this balanced diet during sahur and also during dinner, during breaking fast. It's important actually in order to give energy, in order to prevent hypoglycemia, and also to give balance in terms of patient metabolism requirement accordingly during fasting Ramadan. So as been highlighted in this slide, the majority of the components of the diet should be a complex carbohydrate, meaning that it should be carbohydrate with a low glycemic index. If possible, example, we can advise our patients that like to take rice during breaking fast to take plain rice instead of flavored rice. For example, try to avoid nasi nasi goreng, nasi tomato, nasi biryani, try to take plain rice with certain additional other foods, which consists of proteins as well as fats and also fibers, vegetables, and so on. I know that it's quite difficult if our patients have the habit to go to bazaar in order to choose this low glycemic index carbohydrate, or to avoid flavored plain rice and so on, because sometimes the stall already provide a very simple a homogeneous kind of food, and sometimes it's quite tasty and quite sugary. So if possible, try to avoid sugary drinks or high carbohydrate meals at the beginning of breaking the fast. If possible, if they really need to take this high carbohydrate intake, or they would really love to take these sugary foods or sugary drinks, if really they require, it should not be alone. It should not be taken during empty stomach. It should be taken together with other kind of food category, for example, with protein, fibers, and so on, so that it can avoid a sudden increase in terms of sugar level post-meal, and after that causing a sudden drop of sugar level post breaking the fast and post-meal. So the sudden increase and sudden drop of sugar is actually not good to our patients. It's better for them to have a standard value of sugar at a certain level that is more homogeneous. So try to advise them not to take the sugary food or sugary drinks alone during empty stomach. In terms of quite simple advice that we can actually prescribe to our patients in terms of balanced diet, it's similar in our picture here. Is actually applicable to the rule of suku separuh that we usually advise our patient, that consists of complex carbohydrate, protein, vegetables, and also a fruit, and also 2 plain glass of water, and also 2 small spoon of oil. So this can be considered as balanced diet for our patients. However, it would be personalized, individualized according to patient preferences. Especially they might reduce the amount of intake, especially during sahur, and they might take some simpler, as long as it include low glycemic index, and also there's elements of fiber, and you're not taking sugary food alone during the meals. I think will be much more acceptable to our patients. So in terms of drugs modification, it would be the important for us to inform our patient before they're entering fasting Ramadan, or even at the beginning of the weeks of the fasting Ramadan. I would say that the changes not much different for our patients that rely on oral anti-diabetic agents, especially for those that are on metformin. I would say that generally of our patients, they are probably on metformin. So for metformin, there are not much changes in terms of the twice daily regime for them. But for those that still rely on sulfonylureas, or for those patients that on glibenclamide or glycoside, these are the group that can lead to hypoglycemia. So therefore, we would like to advise them to reduce the dose, especially during taking sahur, possible to reduce or omit the dose according to their experience of hypoglycemia or prediction of hypoglycemia individually. In terms of insulin, so for those that taken basal insulin, for example, long-acting insulin or intermediate-acting insulin, there will be not different in terms of the dose, because they can take it only once, and they can take it as usual time during the night or bedtime. So there are not much reduction of the dose unless they have symptoms or they have experience of hypoglycemia. So possible the dose need to be reduced a little bit lower. But for those that on basal plus or basal bolus regime, so we need to omit or avoid the pre-lunch dose, as it's clear that the patient is fasting during that point of time. And for those that pre-meal during sahur, pre-sahur, we can actually reduce further the dose, because most of our patients does not take much food, or not taking higher amount of food during sahur compared to during breaking fast. So now we come to the principles of physical activity prescription to our patients during diabetic Ramadan. I would say that the physical activity advice should be continued even during fasting Ramadan according to our patients' stratification risks. And for those that actually falls in the low risk and medium risk, light and moderate intensity of exercise can be advised on regular basis, and most guidelines would actually recommend this continuous exercise, if it's going to be performed quite long time, it should be performed at least during 1 to 2 hours after breaking the fast. And some also would recommend to do it during 1 hour before breaking the fast. I would say that it can be applied as long as our patients have low risk of hypoglycemia and they can aware of low risk of developing severe dehydrations. And considering about this guideline of performing the exercise 1 to 2 hours after breaking the fast, I would say that it's really in line with our religious activities of performing taraweh after Isha, whereby it also can imply in terms of physical activity for our diabetic patients. And based on evidence-based medicine, as I mentioned just now, for those that practice taraweh continuously for 20 days and beyond, it can increase the basal metabolism rate of our patients and therefore increase the calorie consumption and increase the body mass, the muscle body mass, and therefore can further reduce the weight of the patients and also improve the glycemic control of our patients. So there's a lot of benefits of performing taraweh for our diabetic patient as well, if they are capable to do that rituals. In terms, I already covered just now, in terms of medical point of view, in terms of what are the modifications that we like to give to our patients, starting from preparation, which means that we need to stratify the risk of our patients and inform them either they are falls in the low risk, medium risk, high risk group, and give shared decision making in terms of the decision to fast, and also about the modification of the diet, physical activity, the patient medications, and also to advise them regarding the awareness to quit or to break fast whenever they have symptoms of hypo or hyperglycemia, and to monitor the sugar level accordingly, if ideally 7 points or even 4 points or 3 points, according to patient's capability to perform the monitoring and to break fast accordingly. So now I would like to include a little bit of Islamic input. So what about our patients that feels they are actually in a high risk group, or those patients that have uncontrolled comorbidities, or those patients that are unable to proceed with fasting in Ramadan because of their current poor health status, also include in diabetic patients. So for those patients that falls in the risk to develop complications during fasting, including diabetic patients, according to fatwa in Malaysia and also from JAKIM, have stated that it is allowed for our patients to break their fast, not to continue with their fast, if they have the condition that it can be worsening or become more severe in terms of complications if they continue fast during Ramadan. So they are allowed to break their fast, and they are allowed not to fast during Ramadan according to our fatwa and also guidelines from JAKIM and also several guidelines as well. But nevertheless, they need to cut out their fasting or need to refast again in the subsequent month before the next Ramadan if their condition is enable them to continue with fasting. Example, that their current control is improved and does not end up with end organ complication and so on. But how about of those patients that this state of high risk are going to be persistent? They have this end organ damage, end-stage renal failure, renal impairment, or any conditions that enable them to fast at any point of time. So therefore, they need to pay fidya, which means they need to pay some amount of money to the Islamic authorities in order to be distributed to the needed pupil or fakir miskin. And this also can be applied, this rukhsah, not only for those that have complications or those patients that have multiple comorbidities. This also can be applied to antenatal mother that worry that their condition might be worsening during fasting, or they might be worried because of their intrauterine fetus condition. So for those that feel that they are worried for their own condition as well as the fetus, so it's together, they can actually break their fast and also to refast again in the subsequent months when they are not in the pregnancy state. But for those that worry just because of their intrauterine fetus only, not because of themselves, so this group of pregnant mothers are required to pay fidya as well, other than refast back in the subsequent month. So I think that will be the current modification principles that I would like to share with all the audience. I would say that it's quite concise, and alhamdulillah we can cover within 30 to 35 minutes. And I would like to invite and I would like to introduce once again our medium to all medical doctors, especially for those that already graduated from IIUM, either during undergraduates or postgraduates, to join us, to join our society in MEDIIUM. And this will be a link for you guys to scan and fill in the form and become our active member in our society. Thank you very much. I pass the session to the moderator, Dr. Nazhan.
All right, thank you very much, Dr. Shaiful, for that very meaningful presentation. I think the amount of knowledge included in the talk was very, I think, comprehensive, and it's very meaningful. I know that we don't have much time to discuss one by one of the points that we have, but in terms of management for diabetic patient, I think it's very, very useful. Thank you very much, Dr. Shaiful, for the CME. So I would like to open the floor for any questions, so that we might have a bit of sharing or some opinions regarding what the strategies that we might impose to our patient, or maybe to ourselves, for the diabetes patients. So I might have probably a few questions as well. So okay, for the fasting, so for Malaysian, they are a bit more what I call persistent on performing the fasting ibadah. So I think the most important is to differentiate what are the symptoms for hypoglycemic and hyperglycemia. So can you highlight to us again, what are the symptoms and what are the steps need to be taken if, let's say, a patient might have this kind of symptom while they were fasting? Thank you.
All right, thank you very much, Dr. Nazhan, for that very important questions. So I would say that education and empowerment of our patient in terms of the signs and symptoms of hypo and hyperglycemia is one of the important steps in order to prevent the complications during fasting in Ramadan. So if we see from a certain templates that sometimes we give to our patients, the signs and symptoms of hypo or hyperglycemia sometimes is overlapping. And the symptoms sometimes is not homogeneous or generalized to all. Some patients does not experience the important symptoms. Some patients might feel that it would be usual for them. And I would say that would be various from patients to patients. But nevertheless, I think the general advice that we can give to our patients is for them to be aware at any point of time if they are in a different state compared to normal. If they feel that something is different, they develop any new symptoms, either they feel that it's become more lethargy, they feel become more irritable, they feel a little bit shaky, they have palpitations, tremors, anything that they have that unusual symptoms. It could be related to diabetic, it could be not related to diabetic. So for those that does not have similar experience, they feel that this is something that is abnormal, it's good for them to check the blood sugar level if they have the glucometer monitoring at home. However, for those that, that's why important for those that have experience from the previous fasting, that can be more rely in terms of the previous experience symptoms, and they're already aware about this, they can just definitely quit the fast or end the fast even without glucometer. But for those that is not really sure about the symptoms, for those that feelings that the symptom is it related to diabetic or not, I would advise them to have monitoring glucometer at home. If they don't have, and they are believe that it will be the symptoms of hypoglycemia, I think we can just advise them to take any foods that is available at home. They can take any sugary or any sweets, fruits or foods. There's anything that is available as long as they are conscious, as long as they can tolerate orally. So this is possible to patients that have symptoms, but does not in the acute complication that leads to unconsciousness, does not lead to any complications that is more worsening. So for those that are still able to tolerate orally, they can take any sugary drinks or any sugary foods or any fruits, because these sugary drinks that is high in carbohydrate can increase suddenly the level of sugar. But what more important is that it should not be stay at home. It should be follow up to nearby clinic, because I mentioned just now, we're not sure about the symptoms of is it hypo or hyperglycemia. So important as well for them to monitor the state of hydration. They might be dehydrated and so on. So this need to be continued with urgent, immediate medical attention to nearby clinic if possible, or even to the acute emergency if they feel that will be the nearest point for them to reach.
All right, thank you very much. There's a question from the chat group from Nur Aisha Bahrum. So, what are the best practice BSP monitoring should be done for GDM mother on insulin?
Okay, thank you very much for that important questions. I would say that what more important for our patients, it will depends on the availability of glucometer. So for our patients that already on glucometer monitoring even before they are fasting in Ramadan, the principle would actually depends on the pre meals and the post meal. It's still the same, because now the patient does not, it depends on the regime of the insulin. I believe that most of our patients possible on basal insulin, so they actually require the monitoring for include the pre and post meals. So meanings that is before sahur, after sahur, before breaking the fast, and also after breaking the fast. But what more important, when patient are on insulin, these patients are basically at risk of hypoglycemia. So as been highlighted in the guidelines, 7 points are the ideal advice for our patients. But nevertheless, I would say that pre-meals and post-meal are actually good enough for our antenatal mother. And for these technical problems, for those that are on insulin and antenatal follow-up, probably we need to advise them to have glucometer monitoring at home, not just to rely on the day visit at clinic, etc., because sometimes it's not really technical in terms of the value of 1 hour, 2 hours post-meal and on before meal. So to be implied with that, it's good that if our patient have glucometer at home, so they can monitor the BSP as pre-meals and post-meal. Because insulin will be depend on the time we would like to take the meal. So it's at the end of the day, it's going to be at the time of taking the meal, either is sahur or during breaking the fast. So at least 4 points, but nevertheless, the ideal one is 7 points.
All right, thank you, Dr. Shaiful. All right, I think that's should be wrapping up the CME for today. But of course, for the record, I think Alhamdulillah we reached, I think, about 200 participants for this CME. I think which is very, very impressive for a starter. Alhamdulillah. So I do hope that from this CME, all of us will benefit from whatever that Dr. Shaiful has shared with us. I think the audience came from many backgrounds. Our lecturers, distinctive seniors, lecturers, and our colleagues, and our own SUSMED staff and IIUM staff, of course. I think the most important is to understand what are the goals in achieving the Ruh of Ramadan. So we know that we want to attain the taqwa from Allah subhanahu wa ta'ala. At the same time, we have to understand what are the magnitude of illness that we are dealing with, so that we can offer them with the best consultation. I think the most important is knowing the where we are in dealing, and of course, like you mentioned, if it is the best for us to know the signs, symptoms, the blood sugar level, and all that. So I do think that this topic needs more exploration in terms of the discussions and all that. But unfortunately, we have limited time to have currently. So I-10 has been shared in the group. I hope that all of us can fill up for the CPD points. Any last words, Dr. Shaiful, before we end? Apart from IIUM alumni and all that, right?
I just would like to say thank you to everyone for joining this session. It's not going to be the only series for MEDIIUM CME series. It's going to be another series, inshallah, in the next subsequent month. And I would like to thankful to our President MEDIIUM, Dr. Nazhan, for stay with us, even though he's currently in London. And with that support, I hope that more and more members and alumni will join our society MEDIIUM, inshallah. And I hope that this session is beneficial to all, and also helping us in educating our patient in terms of modification of diabetic management in Ramadan. Thank you very much, Nazhan.
Thank you very much to all again. So I think I hope all of you have already filled out the I-10. With that, shall we end the session with the recitation of Surah Al-As and Tasbih Kafarah? Bismillah. Okay, thank you very much. Happy fasting, happy Ramadan. With that, I end with Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.